Hey, it's Dr. Tasha, and I'm back talking about hidradenitis suppurativa, aka HS, aka the boils. Essentially, what HS is a skin condition. We don't know why. Some people get it, some people don't. It tends to run in families, but we're not sure whether it's genetic or not. Women get it more than men, but men do still get it. And what it is, it's a condition where people tend to get what looks like boils, or they used to call it inverse acne, meaning acne that's actually under the skin. And with the inverse boils, you get them in areas where you have sweat glands and hair. So that's like, it could be the crack of your butt, it could be your butt cheek, the groin, the top of the vagina, under the breasts, under the arms. It can go from mild to severe. It can be very, very debilitating. But what tends to happen is when you have what we call flares, for different reasons, the small bumps or the areas turn into boils, and they will either drain pus or blood. They can get infected. Sometimes they smell. They're very, very painful. So imagine being a person with HS and trying to have a normal dating life or a sex life when you have a condition that you look infected or you look contagious. So it really, really, really bothers the spirit of the people who have HS. The worst part about it is there's not a cure for it. There's nothing to do for it preemptively. That means that once you get it, or once you have a flare, we know that we can use antibiotic body scrubs or body washes, and antibiotics themselves if we're infected, but there's nothing really to do to prevent it or treat it or cure it per se. And I always feel like if there's no medical treatment for something, then let's look at the holistic. And because I would see so many patients with this, and I'd be the one diagnosing it, they'd never heard of it. Their primary was like, what is this? We don't know. Or the dermatologist, whatever the case may be. I was the one diagnosing a lot of patients, and they were like, well, what do I do? And there was nothing really to tell them. So in this case, it sent me into the lab literally to create a product for it. So when I talk to patients who have HS, if you're an HS haver, one thing I'll say is lose weight. Obesity is a thing. Smoking is a thing. Wearing tight clothes. And your body should always be cool as much as possible. So hydrate as much as you possibly can. Alkaline water if possible. You should have a non-inflammatory diet. Try to follow the Mediterranean diet, but decrease your grains. There should be minimal sugars, minimal processed foods, minimal fast foods. Those things will help you with flares. On the everyday basis, prophylactically, and I'm not saying this because it's my product, I developed it for you guys, use Clean and Cute HS or the HS bar. And what it does is it kills the bacteria that are on the skin, decreasing the risk of having flares, decreasing the risk of getting infected when you do have flares. Okay, and that's an everyday product on the areas where you have HS. If you should have a flare, yes, you can use an antibiotic scrub. I'm sure you guys know which ones it is. You can use antibiotics for those things. Also, try and drink burdock root tea. Just different things that are going to keep you non-inflammatory, keep your body cool. Look forward to living a healthier, cleaner life. Stop with the smoking and decrease the weight if at all possible. So at the end of the day, prevention, prevention, prevention. So change your diet, change your lifestyle, and use the Clean and Cute HS bar if you have HS. I hope this blessed somebody.